Each year, 2 million high school athletes are injured. Some of them require physical therapy treatment and some don't. Physical therapy is used to help those who are injured and need relief. I've done a lot of research the past few weeks, and with my own experience, I feel like I have a lot of knowledge about the topic. Today, I will discuss what a physical therapist is, why we have them, physical therapy as a career, and the types of treatment they use. First, what is a physical therapist? A physical therapist is a healthcare expert who can help their patients diminish their pain and increase mobility. They help decrease the need for surgery and long-term medications for pain relief. They also help diminish the need for cortisone shots and things like that. We have physical therapists to help all ages improve circulation, range of motion, and help regain full function of their body. They also help eliminate pain and give you relief. Columbia University Press online encyclopedia stated in 2016 that physical therapy treatment is used to help those who have or had a stroke, fracture, nerve damage, muscular dystrophy, cerebral palsy, neck and spinal cord injuries, arthritis, or a limb amputation. Now that you know what one is, I'll tell you about how to become one. To get into a PT program, you need to have a bachelor's degree, which is a 4-year program, which is a 4-year degree. Or you can do a 3+3 program where it's 3 years of undergraduate schooling and then a 3-year DPT program, which is a doctorate of physical therapy. You must have the doctorate of physical therapy, which is usually a 3-year program. So altogether, it's at least 6 or 7 years of schooling. Or you can have a graduate degree, which can either be a master's or a clinical doctorate. You must get your education from an accredited physical therapy program. The Bureau of Labor Statistics by the United States Department of Labor stated in 2015 that you must get your degree from a Commission on Accreditation in Physical Therapy Education accredited program. Across the nation, there are around 200 schools available. Their salary ranges from $79,472 to $85,000 a year, and their salary ranges depending on their position, where they're located, their years of experience, and their degree that they have. Donald E. Timper, editor of PTInMotionMag.org, wrote in 2016 that depending on certain qualities, there are better states than others to get a job as a physical therapist. Some of the states that they mentioned that were better were Utah, New Hampshire, Colorado, Washington, North Dakota, Minnesota, and California. You can find a job in physical therapy in all 50 states. Simone Isadora Flynn, writer of the Salem Press Encyclopedia, stated in an article in 2013 that the work environment for physical therapy ranges from nursing homes to schools and hospitals to clinics. A few others are work settings, private practices, and sports and fitness facilities. Now that you know about their schooling, I'll tell you about some of the treatments they use to help those. They use ultrasound, which uses ultrasonic waves that create a high-pitched noise that causes the instrument to produce a vibration. They use gel on the, which gives the tool a way for the sound waves to travel. The gel is also used so the waves don't deplete when they meet with the air. The tool gives off a warm, soothing sensation which helps relax your muscle. A-stim is a kind of harder plastic tool that they run along your skin with pressure on your injury in the direction of the muscle, tendon, or ligament. The tool should hit bumps in the skin, which is the damaged tissue. Sometimes it can be very painful depending on the person, but it helps regenerate the soft, healthy tissue and decrease scar tissue. electrical stimulation, or some people refer it as e-stim. It uses electrodes, which are the pads that are either circular or square, that convey impulses that make the muscles contract. E-stim helps rebuild your strength in your muscles, and it increases your range of motion and enhances your circulation. It also is used to help muscle cramps and pain. And then dry needling and electroacupuncture. They use a thin acupuncture needle that they insert into the muscle or trigger point, and depending on where your injury is located, the needles range from 100 millimeter to 75 millimeter and shorter. They send electrical impulses through the needles, which helps the muscle contract a lot to help it relax. A trigger point is a knot or a tight band in the muscle. It helps relieve that trigger point pain and to help increase your range of motion. It also helps treat anything from headaches to spinal nerve compression pain and pain such as sciatica, which is your nerve that goes down your leg when it gets pinched. It can help relieve pain like that. Today I talked to you about what a physical therapist is, why we have the physical therapy as a career, and the types of treatment. I hope you can use this information to help you in your future if you ever get injured. Thank you.